Hi friends, today I'm going to be talking about the differences between the infectious diarrhea and non-infectious diarrhea. I believe out of 100% that I watch me today have experienced this what we call diarrhea. So diarrhea is a passing out of a watery stool more than 3 times a day. And we have infectious diarrhea and non-infectious diarrhea. And that is why today I'm going to be talking about some of the differences between these two. Which the difference goes in this way. Let me start with the infectious diarrhea because many people don't know the differences, and that is why we have been having so many challenges and so many problems. When you eat something that your stomach will upset, person will now be taking flagyl or metronidazole or something of that nature that will make that person to feel relief from that discomfort. So, starting with the infectious diarrhea, let me start with the cause of this infectious diarrhea. Because this infectious diarrhea is triggered by a pathogens such as bacteria, and this bacteria, example of it is salmonella. This salmonella is a bacteria that actually causes this infectious diarrhea, and we have a virus such as the rotavirus or a parasite such as Giardia. All those parasite, viruses, and bacteria causes this infectious diarrhea. And that is why sometimes when you are taking some medication, instead of that diarrhea to be decreasing, it will be now be going or it will be increasing. So that is the problem that we are facing. Let me go for the symptoms of this infectious diarrhea. You see, this infectious diarrhea often accompanied by some fevers, some nausea, vomiting, and abdominal cramps. That is why some people used to, join it together. Instead of treating the infectious diarrhea, they will go treating the non-infectious diarrhea because they don't know. You understand? That is why this is for your educational purpose. And let's go for this transmission of this infectious diarrhea. Many people uh, don't know that this infectious diarrhea actually spread through some of the contaminated food, water, or contact with infected individuals. You will actually be transmitted or be contracted from this infectious diarrhea. And some of these examples of infectious diarrhea like food poisoning, cholera, viral gastroenteritis, those are examples of this infectious diarrhea. So let's try as much as we can in order to know some of these differences. It will actually help us a lot in terms of treating it. So sometimes people tend to do a self-medication, but with this, some of this knowledge, we'll be able to identify or to know the main root, the main cause of this, or the differences between this infectious diarrhea and the non-infectious diarrhea. And let's go for the non-infectious diarrhea. Okay, so you see, let's go. Going to this non-infectious diarrhea, we are going to talk on this cause or the cause of this non-infectious diarrhea because this non-infectious diarrhea is not caused by pathogens. Instead, it results from factors like food intolerances and such as the lactose intolerance. And another one is caused by some medication, for example, now some antibiotics, and it also caused by autoimmune disorders such as this Crohn's disease. This Crohn's disease actually caused this non-infectious diarrhea, and some of these cause one of it again is irritable bowel syndromes, which we know it as IBS. All this IBS can actually cause this non-infectious diarrhea. So let's continue in order to know some of these differences. It will actually help us a lot. And I'm going to be talking about some of the symptoms of this non-infectious diarrhea. Because this non-infectious diarrhea is typically lacks fever or infectious signs. but it may involve like some of this chronic or intermittent diarrhea. So now, what actually triggers some of this non-infectious diarrhea? You know, uh, there are some things that will actually triggers it, like the diet, stress, some medical conditions, or some medical irritants can actually result to this, or it can share it will be a sign and symptoms of this non-infectious diarrhea. And these chemical irritants, this diet, mostly what happens within our communities or within our own jurisdictions is this diet. Because diet, like a combination of pap, some beans, some marmite, which will result in this non-infectious diarrhea. And now there are some examples of this non-infectious diarrhea that it will help us in order to differentiate between the infectious diarrhea and the non-infectious diarrhea, such as um, diarrhea from celiac, diarrhea from celiac disease, or side effect of chemotherapy. These are the examples of this. So let's try as much as we can in order to know some of these differences. And that makes some people, when you are purging or you are feeling some some diarrhea, some signs and symptoms of diarrhea, you don't actually differentiate between the infectious diarrhea and the non-infectious diarrhea. But knowing the differences will actually help you in order to know the difference and to know about the treatment again. So just stay in tune. By the special grace of God, next time I'm going to be talking about some medications or the treatment of the non-infectious diarrhea and the infectious diarrhea. Because if sometimes we tend to treat infectious diarrhea with the medication of non-infectious diarrhea, and sometimes we just interchange it. You understand? So interchanging it will worsen the problem. So instead, please follow me and continue to share it as we know the differences and how we can tackle this problem that we are facing. Because many people spend a lot of money, in treating this, and it's something that is very simple and straightforward. You only just use maybe a drug of 15 naira in order to treat it. But because you don't know the differences, you don't know how to treat it, you will now be, taking some things that will trigger or it will worsen the problem. So thank you for watching, and keep in tune as I continue to share some of the health tips and some health uh, talks that will educate you. All this health talk is for your own, is for educational purposes, both for those who are in school and for those who are not even in school. Thank you very much.